Helping to make your family healthier. As we told you yesterday, the governor unveiled his huge health care plan, including a big wellness initiative. And the governor, Rick Snyder, joins us now to talk about it. Thanks so much for being with us. Good to have you with us.
Well, it's great to be here.
You know, part of the plan you talk about is this reporting of a child's body mass index, or BMI, to a state registry. You want to clear up some confusion, though, about that part of the plan.
Yeah, it is something that people took it beyond a step of what we actually said. And it's a voluntary program. It's really to say, when a healthcare professional is working with a child and they believe it's appropriate, here's a database where they can enter that data that would be kept anonymous in the general sense, but it would go and allow us at the statewide level to see how we're doing. So it would go towards a dashboard measure to really allow us to do that. And that's something we've been doing for over a decade with child immunizations. So that kind of registry already exists. We would just be adding another field. And we found it worked really well with childhood immunizations, because we were one of the worst in the country in that area, going back about a decade. And by creating this voluntary program where people could help enter data, it gave them more visibility, more times to discuss it, and now we're up to 93%.
Wow.
In terms of child immunization. So we're doing well relative to the rest of the country in that field.
But we have so much to do with obesity.
With childhood obesity, too.
What is the percentage? Something over 12%?
Over 12%. So the idea here was no mandates, nothing required, but let's add a field to a registry that already exists that allows another forum for good discussion with the healthcare professional and their patient and their parent. And at the same time, on an anonymous basis, add data where they believe it's worth putting that data in, that then we can have better metrics and measures, because to know how we're doing, we've got to have good information. Yeah. And so that's something that I believe is, most people would think is a good idea. Me as a parent with my child, I would be happy to contribute information to something like that.
Right. Let's bring this out now to adults as well. Part of this is also this 4x4 plan, which we like that. We live in Detroit, right?
Yeah. Well, we want to have some fun with it, and 4x4 is a great name because you don't want too many things to think about. And the simple thing, this is about us just taking care of ourselves, personal responsibility. And there are 4 behaviors that if you do these things and you look at 4 measures, if we achieved it, so our entire population was in the acceptable range of those 4 measures, we could cut healthcare costs by more than half, which is staggering. Yeah. And the 4 behaviors are eating healthy, getting regular exercise, avoiding tobacco, and getting an annual physical. Those are things we can all do. And then the measures are your weight, or BMI, your body mass index, your blood pressure, your cholesterol, and your blood sugar. And just to kick it off, I'm trying to be a good role model. So literally, I was getting measured at the message, and I went to my doctor and got the other statistics, and I put them up on my Facebook page. Rick for Michigan, you can go see. And I got to tell you, I got 10 pounds I got to lose.
Well, you know what? We're all in this together. Yeah. And if we all take these simple steps, we can move this state forward, and it's so important to the entire health, really, of our state. So, Governor Rick Snyder, thank you very much for taking the time to talk to us about this.
It's great to be here.
You have a great day.